Good evening. Thanks for joining us. We begin with the tragic death of a 23-year-old woman from Nanaimo. She's one of thousands in BC without a family doctor, and she struggled to get treatment for her declining health. Her family says by the time she got the proper diagnosis, it was too late. CTV's Yvonne Raymond has the story.
Staff at a Nanaimo shelter are grieving the loss of an employee whose health, they think, slipped through the cracks of a system in crisis.
It's tragic. It's completely unacceptable. It's completely avoidable.
Sophia was a 23-year-old mental health worker.
She was just a go-getter. She came out of university. She really wanted to help people.
Last March, her health started to decline. She would take a leave of absence in June and consulted with doctors at a walk-in site since she didn't have a family physician of her own.
The first misdiagnosis was that she had some kind of eating disorder. And, you know, she knew that she was trying to eat. She actually had some challenges with her immune system, and she had an infection.
She died in a Vancouver hospital in November, after also visiting Nanaimo General Hospital's ER twice. Her mom has filed patient care complaints with the College of Surgeons and Physicians and Island Health, neither of which can comment on the details of the case under privacy laws.
Without commenting on this particular case, it's obvious to everybody it's a lot easier to get looked after if you have a family doctor or nurse practitioner who's supporting your care. And our government is doing all we can.
Sophia's mom, Melanie, says, "I don't want her death to be in vain. I want changes. I don't want to see any other family have to go through this again. This is a first world country. Our system should not be crumbling the way that it is."
23 years old, that's it. Such a promising life in front of her. She should be alive. She should be on shift this week.
Yvonne Raymond, CTV News.
Sophia's case got attention in the legislature this afternoon. Here's part of the exchange between a Conservative MLA and the health minister.
She died at the age of 23. 23. And it was preventable. Mr. Speaker, will this Premier admit that the healthcare system in British Columbia is broken under this NDP government?
It's difficult under the circumstances of someone dying so young to bring comfort, but to bring knowledge of circumstances and seeks improvement and review for the system, but also justice for people. And that's what we're doing in that case.
The provincial government says it's hired 700 new family doctors in BC, and it continues to do that work.